So I want to talk to you about what is a FODMAP. So FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides and polyols. So polyols are sugar alcohols. So FODMAPs are short chain fermentable carbohydrates, and these include things like fructans, galacto-oligosaccharides, lactose, which is the milk sugar, fructose, which is found in honey and in some fruits and vegetables, as well as sorbitol and mannitol, found commonly within fruits and vegetables. So the low FODMAP diet is a diet where we restrict these fermentable sugars. So the reason for this is that FODMAP intake can lead to symptom induction in patients with IBS. Now this works via two different mechanisms. So firstly, FODMAPs, so these chains of sugars here, when they travel through the small intestine, they can cause water to enter into the small bowel, and that's where you might get things like gurgling, pain, some urgency to open bowels, that type of thing. After that, FODMAPs travel through into the large bowel, and here they are fermented by the gut bacteria. In response to that is the production of gas, and that's what leads to things like bloating, pain, distension, flatulence, those other types of symptoms that you get with irritable bowel syndrome. So we know that luckily enough, there's been a number of studies with patients who've been put into MRI machines, and they've been able to track what happens when they feed them FODMAPs. So in this study, a patient was put into an MRI machine and they were fed an excess amount of FODMAPs. In this case, fructose was the FODMAP that was used. And what you can see here is that in the small intestine of this patient, after having a high dose of fructose, there's a dramatic increase in the amount of water in the small bowel. And this is because when you get a lot of fructose in excess of glucose traveling through the gastrointestinal tract, it has a kind of osmotic effect, so drawing water into the small bowel, what I just showed you in the last slide. However, if you have fructose and glucose in equal concentrations, so some fruits have got fructose and glucose in equal concentration, they're allowed on the low FODMAP diet, whereas other ones, like say mangoes and figs, which have got an excess of fructose, you wouldn't take those on a low FODMAP diet. But as you can see here, when you add fructose and glucose in equal concentration, there's another transporter mechanism that increases the intake of fructose when it's holding hands with glucose, if you like. So you see in this image there's much less of that kind of water within the small bowel. Now the second mechanism, so once FODMAPs have travelled all the way through the small bowel, if they've increased water, then that will travel with them into the large bowel. But when they get to the colon, here's where they're fermented by the gut bacteria. So FODMAPs provide food for the gut bacteria, and in patients with irritable bowel syndrome, there's an increase in gas production that leads to an increase in symptoms such as abdominal pain and discomfort. And you can see here, this is about 5 hours afterwards, but this same person was fed fructans in a high dose. So fructans are the types of FODMAPs that are found within things like wheat and onion and garlic. And you see here that this is all gas within the large bowel that can be seen in the MRI here. And that's due to bacterial fermentation about 5 hours after having eaten it. And that is what FODMAPs are and how they work within the gut.